Hi everybody, it's Jessica with Pilates Happy Hour. I'm so happy to have you here today. We're going to do a routine that's great for low back pain. So whether you feel tight in your back or whether you have pain, it's a great thing to do to help you warm up and also really help strengthen the muscles around your low back and your core to help decrease the pain and decrease injury in the future. So we're going to start on all fours. Have your hands under your shoulders and your knees under your hips. This is called cat camel. So I want you to really be strong here and exhale round your back. So use your belly button to pull your abs up towards your spine. Let your head just hang. Then on your inhale, go the opposite way. Head comes up, tail comes up. So extension in your spine. So go at your own pace in your own breath. Exhale to round. Here's your flexion. Inhale to extend. So if you have tightness or pain, you might feel like you're not moving at all, and that's okay. All right, just do what you can do and really focus more on the abs. Focus on that pelvis rounding. And we'll do a couple more. So exhale, tail rounds underneath you. Lift. Inhale. Spread your sit bones apart as you stick your tail out. Last one. And inhale. And then we're going to go halfway in between those two. So really important to keep your back flat here. That's what we're going for. Keep your back in this position. I want you to straighten your left arm out in front of you. You might stay here, or if you're okay for balance, right leg goes back. So what we're working is that you're trying to keep your neutral spine, that flat back, while keeping lifted. So basically I don't want this, right? I want the abs up, reach, reach, reach out. Let's lower back down and switch sides. Let's do a cat again. First, camel, find halfway, and then right arm, pull the belly up, and left leg. And let's lower back down, and we're just going to do a couple more here. So arm and leg, other side, reach, 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 and lower. And again, just do the arm or just do the leg if you need to start. Okay, last one. You're just trying to shift and move in your spine as little as possible. You're a statue in your spine. And then here, good. And then knees come wide, sit back, child's pose. Move your hands over to your left, cross your right hand on top, and just get a really nice stretch for your right side body here. You're actually tractioning your vertebrae slightly on that side. And then we'll just move the hands over, other side. And then back to center. And then roll yourself up. And we're going to swing the legs around in front of you. So knees are going to be bent here, about hip distance apart. Hands behind your thighs. And I want you to curl your tailbone and roll back till your arms are straight, and just see how this feels. So you should have a tuck on your tail, your abdominal muscles are contracting, and your shoulders are down. And then we're just gonna come right back up, and we're gonna work through that a little bit. So start tall, inhale, exhale, curl your tailbone and roll back. Inhale, pause. Exhale, just round up and sit up nice and tall. So if you're a little more advanced and you aren't necessarily in pain, you can go to arms here in front of you. The beauty of working outside, you get lots of nature on me. Inhale, exhale, curl. Inhale, pause. Exhale, round, and sit up. So either one, I just don't want pain. So if you're doing this routine, obviously you've had back pain at some time, most likely in your life, or some back tightness. And that's okay to feel tightness here. That's normal. Or to feel some shaking, right? Muscle soreness, that's normal. I just don't want any sharp pains. I don't want it to make your pain worse. So that's why you're gonna kind of just decide, you know, do I want to start with my arms here, or am I advanced enough, or my abs okay that I can work them a little more here? And round. All right, so last one, we're gonna roll all the way down. So what we're doing is we're really kind of lubricating and loosening up your back. We're trying to retrain it how to move. I want you to roll down one vertebrae at a time, all the way onto your back. And then we're gonna bend the knees, hip distance, they're probably going to be about where they were. Arms down at your sides, and we're going to go into that rolling again. So on an exhale, curl your tailbone and just roll and tilt your pelvis towards you. I just rolled barely my sacrum, my low back off, and then bring it back down. Exhale, curl. Inhale to lower. So that's what I want you to think of, is that idea of lubricating the joints, trying to convince them that it's okay to move again. A lot of times when we have injury and stiffness, literally the joints kind of stop moving. We guard them. We become scared to move. And movement is life to joints. They need that. They need that fluid moving through them. It really is like WD-40. And so we're trying to gently show them how to move again. All right, so on this one, you can start to roll a little bit higher into a full bridge. Inhale, and exhale, curl and roll back down. So the key is trying to roll one vertebrae at a time. Press through your heels, roll up. When you come down, start at the top. So roll at the top, lower, 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 lower. All right, on this one, I'm going to add the arms. Roll up. Arms come up and behind you, and then roll down. And you get this great, nice traction again through your spine. Arms come down. Exhale, roll up. Inhale. Exhale, roll down. And let's just do one more like that. And the breath is really important too, because we want to kind of make a calming place for your body to move from. And when we're breathing really fast or holding our breath, then the muscles actually get tense, which is great in fight or flight or in some really high intensity cardio work. But when we want to just kind of loosen up and help strengthen the back, I want your body to calm down a little bit. So we're going to be here now. Keep the belly pulled in. You're going to lift your right leg to what we call tabletop. Now, you might really be here where you lift one, lower, lift the other, and lower. The goal is keeping your abs in the whole time. I'm going to show you a little more advanced where you bring one up, contract your abs, bring the other one up. So we have both legs in tabletop. Now we're going to do toe dips. Exhale, lower one leg down. Inhale, lift. Other leg. The key is not letting your back arch off the mat at all. So if this happens when your leg lowers, then it's not working the abs at all. It's going to hurt your back. So you have to keep belly button to spine. Almost feel like you're slightly pressing your back down into the mat. And again, if this is too much, then you're just going to lower both legs down and just do that alternating marching that I showed you. And then one more progression, if you want it, is both legs at the same time. Again, this is more advanced. We'll just do about 5 more. Really important to not let your back arch. I know I keep saying it, but it's the most important thing. If I was there with you right now at home, that's what I would be making sure of, is that you're breathing and that you're not letting your back arch. Very nice. So we'll come up, lower one leg, lower the other leg. Now let's bring hands behind your head. Inhale, exhale, you're just going to lift upper body. Now, inhale, turn to one side. Exhale, center. Inhale, other side. Exhale, center. Inhale, down. Okay, same thing. Exhale up through the center. You're not pulling on your neck. You're just supporting your head. Turn, center, turn, center, down. We're just going to do 2 more. Try not to let your knees move. So now I'm going to turn to the other side first. So my hips and my knees are staying completely still. Last one. And then lower back down. Nice job. Arms come down. You're going to bring the legs together. Arms out to the side. Let your knees fall to the right, and you're going to look to the left. And just breathe. Feel length on the side of your body. And then slowly come up to center and use your abs. Okay, don't just swing your legs up. Use your abs to come back. Let's do the other side. And then back up. Very nice. So now you're going to roll onto your side. So you're going to come all the 2 options. You can be here or here, whatever's more comfortable. These are called clamshells, knees together. Make sure your hips are stacked and your shoulders are stacked, and you're going to lift just your top knee. Now you're only lifting it as high as your hip doesn't roll back at all. So you make sure the hip stays right where it is and the knee comes up and the feet stay together. This is working your gluteus medius, one of your hip abductors. So it's going to help strengthen your hip, which is really important for stabilizing the back. It's also doing something called rotary stabilization for the back. You don't need to know what that is, but that's one of the reasons it's important to not let the hip roll back. I want you to keep your back in that nice, flat, stable position while we put this other force on it. So it's kind of playing double duty. It's one of my favorite exercises to give folks with low back pain. And again, you always want to check in with your doctor. Always talk to a physical therapist. Find out what's going on before you start a new program. But these exercises can really help prevent injury in the future and help get you stronger if you have some weakness in your core and in your low back. Good. All right, and then we're just going to do the other side. So be careful, especially with back injuries. Sit yourself up safely, and then we'll just go to the other side. You can always roll over as well. Usually it's easier to just kind of sit up and turn over though. So here, hip stacked, shoulder stacked. When you're ready, exhale, lift. Belly button pulls to spine the whole time. Top arm can just be on your waist or at your side. And then just make sure everything is still stacked so you're in one straight line. Your feet are about in line with your tailbone. So you should be feeling this eventually right about here. Feel free to do more repetitions if you need to. If you get the routine down, you can just pause the video and do more if it feels right to you to do more. And then if you progress from there, you can try our Pilates for Beginners Level 1. That's a great place to go from here too. All right, let's do 2 more. And last one. Great job. And then just go ahead and press yourself up to a seated position here, and we're going to come back to cat camel. Okay, one more round of the same thing that we started with. Hands under your shoulders, knees under your hips. Let's exhale round. And inhale to arch. See if you maybe have a little more movement in your spine now. Nice job. And then one more time, just sit back and roll yourself up. And congratulations. Thank you so much for joining me. I hope your back feels a little bit better, and I'll see you next time.